And mahirap kasi magsabay na you're the lecturer and you're the moderator at the same time. Kaya Sir Jackson, thank you for facilitating all these materials sa Zooming sa atin.
No problem po, Doc. Letty.
For Dr. Oli, happy birthday.
Happy birthday. Since we haven't, we won't be starting our lecture yet right now. Let's give a few more minutes. Would you all like to unmute first for a few minutes, then we can go on mute again later. Happy birthday, Doktora.
Thank you po, Dr. Jackson. Salamat po.
By the way, we're live streaming right now on YouTube. But it's for latter use. Doc, Dr. Lagaya, baka, before we start, baka may update po kayo para sa org or anything?
Yes. I just came from another teleconference with Hospital de Maynila. What we did was, since it's a participation by the residents of Hospital de Maynila Family Medicine, plus the interns, it was more of the presentation came in with the pre-test and then the lecture proper, followed by the post-test. So the audience appreciated that kind of parabang school style na nagkakaroon ng fill in the blank sa minds nila before the lecture happened. So mas trabaho, mas mabusisi. Pero what happened then was the speaker, the first year resident who gave the talk, nagsimula kami sa suspect as what we did here in PAAI. So yung suspected cases, next week it will be the confirmed cases, what we do now. Ang nangyari, hindi lang yung WFAS recommendation, following the points, nagpasok din siya ng PSMID recommendation on how COVID is classified, stratified, and then yung pictures where the points are. So when they're talking about where is DU14, palalabas. So sa mga magagaling sa acupuncture, hindi na kailangan tignan yan. But for us who needs to review over and over where the points is, it would be highly recommended that we review such. And then since suspected cases yung una natin na pag-aralan sa PAI, I think it was given by yung una speaker natin. It would be nice also that you put yung beads or acupressure points on the sites ng katawan natin at saka ng ating mga loved ones. In that way, yung mga anak natin who does not know where DU14 is, where is the chi high point, pag nilagyan nyo ng yung sticker beads, if you're familiar with this, alam nyo naman to?
Yes, Doc.
So, yeah. So, what I would suggest, alam nyo na to, and then if getting a bid, so familiar tayo do sa bid and put it where you wish it placed according to the WFAS recommendation, and meron din recommendation group 1, group 2, group 3, apply it to your loved ones. So even the youngest of your children can do pressure as a way to enhance your immunity against the COVID, in addition to the face mask, in addition to the social distancing that we're doing. So something to practice what we're preaching sa mga mahal natin sa buhay. Of course, if you do that to patients, it is also recommended. But of course, pag pasyente na yan na may COVID, we refer it to the agencies involved. That's what I will recommend now for the lecture that will follow now on today, which is the lecture of Dr. Mikey on home treatment. So probably you can do the same, apply this on your loved ones sa home treatment ng ating mga pasyente.
Thank you po, Doc. Anybody has any questions? You can, for now, we can unmute first and have a small discussion habang wala pa si Doc Mikey. Anybody wants to ask anything about ear seeds? Naiya pa yata, Doc. Nagwa-warm up pa.
Sir Jackson,
Po.
pag marami na tayo, i-update ko na rin kayo sa research kung ano
Okay.
nangyayari. Ano yung problema and what is the contingency plan we're doing that will also involve PAI members. Mamaya na yung pag marami na tayong tao. Maybe
Okay.
in the latter part.
Okay. As of now, Doc, we're already 63. Medyo
Wow.
dumami na.
Good. Dami. That's good.
Yeah.
Welcome to the newcomers today.
Let me go offline lang, Doc, for a while. I'll just check on Doc Mikey.
Hello, Dr. Tan Chong.
Hi, Dr.
Dr. Tan, welcome. I didn't see you arrive.
Good advices. Yes. Hi.
Go ahead, Doc. Baka you have any messages you want to share before we start kasi wala pa rin si Doc Mike.
Well, number one, we'd like to say thank you to Doc Al for the very good advice. Okay, and then so after Doc Mike, our next speaker will be si Tita, not Tita, sino ba ito? Si Rochi, Miss Rochi, Rochi, si Rochi, and then followed by the lecture of Dr. Deliasa, he'll talk about the mental health associated with COVID. Okay. Oh yeah, andyan na si Doc Mike, Yes. Doc Mike, welcome.
Hi.
Doc Mike,
Hello.
welcome.
How's
Good
everybody?
Yes.
Very good.
You're the superstar today. Yes.
Ako ba? Akala ko ikaw na. Hindi.
No.
Joke lang.
Ang ganda ng background mo, Doc Mike. Okay.
COVID. Okay.
Yes.
Naka-long pants ba kayong lahat?
Di halata. Actually, naka-shorts lang. Pero naka-long sleeves.
Wow, formal.
Okay. Before we start, I would like to remind everyone to please put your audio on mute. Then after the lecture, you can type your questions in the chat box for Dr. Mike to answer. Maybe on the latter part, that's the time you type your questions para it won't be blocked off by ibang messages. Okay? Thank you. I'll turn you over now to Dr. Mike.
Yes.
Mike, would you like me to play your slides?
Okay. So it's with you, Yeah, I just wanted to, Yeah, let's have the first one.
Okay, hold on for a while. Yeah, is it coming out?
Yes, it is. It is, at least in mine. Let's go to number 1. Okay. Enlarge, please.
Wait lang.
Okay. Not yet.
How about now? Is
Okay,
it better?
yeah, it's good.
Okay.
Can everybody see it, ba?
Yeah. Everybody thumbs up if it's good. Okay.
Okay.
It's good, no, Jack?
Okay.
Guys, so the topic today is home care of COVID-19. Yeah, let's keep it first in the first page, Jack.
Wait.
Yeah, let's go back again. One more page. Okay. Kasi may konting introduction ako .
Okay.
I have a song written by, no, joke lang. Well, again, first of all, thank you everybody for joining in this webinar. It's a good way to make best use of our time. No? When this protocol, no, from WFAS, no, when this protocol for the treatment of COVID-19 came out, in the PAAI board, we were discussing who was going to lecture on this, no? And we noted that there were 4 parts, diba? 4 parts to this lecture. And initially, I said, sige, I will take the first part, okay? And then, well, somewhere along the line, no, because I don't answer my email right away, I found out na hindi na pala ako ang una, no? Ang unang magle-lecture. And sa second na lang daw, no? Said, okay, akong second lecture. Approaching lecture time, no, or lecture date, ayan na naman, no? Hindi na naman ako nag-respond sa sa mga communication. And by the time I knew it, may nag-lecture na second lecture. So I said, sige na nga, just to be sure, third na lang ako, no? The third lecture. Well, same old story, no? I think it was Dr. Asasa that did it, no? So no choice. I said, no choice kami, Mike, no? Last lecture ka na, diba? So ito na yan, no? Last lecture. And when I was going through it, no, and making my presentation, I knew this was the lecture that I was supposed to share with you. Okay, I knew this was supposed to be it. No, it was more of a an enlightenment. No, that this is the lecture that I am supposed to share. No, not the first, not the second, not the third, but this one, COVID. Kaya again, welcome. I have lots to share with you. I won't just go and share or explain what the protocol is. No, if you know me, I'm not a very black and white person. I like to put a seasoning of myself, diba? I want to share where I'm coming from, no, or how I understand things. And not just list down, no? Oh, ito ang dapat gawin, A, B, C, D. Hindi po ganyan ang style ko ng education, no? I want to share personal experiences, no? And as I make kasi as I make the presentation and go through it, no? As I prepare for it, I actually pray, would you believe, no? And I try to get guidance from above, no? As to how to present it, where to stress, what extra things should I say, what not to say, and all that stuff. Okay, so I just wanted to mention that as my opening statement, no? Because aside from leaving some of my thoughts, no, I want to leave some of what my heart has or what my heart wants to express. Okay. And again, for those of you who know me, I practice integrative medicine. So my approach isn't just plain TCM, no? Maraming iba't ibang aspeto ng healing that I put into it. Okay, Jack? Let us go. Okay, so itong outline ko, no? It's very short. I'd like to spend most of the time answering questions, okay? But so it's home care of COVID. No? The topic actually is COVID and how we handle it when the patient or we are at home. No? So for the first part, I want to talk about COVID. No? If you want to deal with something, you have to understand it very well. And in these last 3 or 4 months, I've talked to many people, and many people are confused about it also. No? And I want to spend time to explain how things really are, no? And then again, because it's a new virus, no? There's not much known about it. The knowledge about the coronavirus, SARS coronavirus 2, is only coming up in bite pieces, small pieces, no? So every day I actually study, no? I study the local and the international trends, local and international studies and researches on COVID, no? And I'm putting it all together for you so that you understand how things are. And I am certain that when you understand the principles of COVID, of how to treat COVID, that you will be a better healer, no? You will have more bala, no? You'll have more ammunition, you'll have better knowledge and understanding of the disease, and you can make better decisions for yourself and for your patients. Okay? So, the two parts, the first is understanding COVID-19. I'll talk about 3 factors, no, that of the disease, how you can catch it or how you can prevent it. And then I'll be talking about the TCM perspective of COVID, very briefly. And then what are the main causes of death of COVID. Part 2 will be a focus on the immune system, the TCM approach, and the nutritional approach. Okay, the combination of TCM and nutrition is an integrative approach. Okay, that's how I do it. That's how many scientists and doctors from England, other countries in Europe, including Italy, no, New Zealand and Australia, and even Japan, and mostly China. That's how they're approaching it. No? We're not approaching it the normal way that the WHO is asking us to do. Okay, although I noticed that konti-konti yung WHO is already opening its mind, no, into the integrative approach that we're doing. Okay, so next slide, please. We're going to tackle first the 3 factors of disease. Okay, number 1 is the quality of the pathogen or the invader. Okay, so there are 3. Okay, let's go for number 2 and number 3 also. Number 2 is the quantity. So you see the first 2 factors of the disease pertains to the invader. No, I want to use that word, invader, because it invades our body. No, or the pathogen. No, clinically or scientifically, it's called a pathogen. In particular, this pathogen invader is the COVID virus. Now, it's called COVID. Most of you will know, no? Initially, when it was first discovered in November, no, in China, it was called the new coronavirus. Okay, new coronavirus. Coronavirus is a family of viruses. Okay, like yung sipon. Okay, that's a virus. It's a coronavirus. No, SARS is a coronavirus. No, the MERS, Middle East. No, that's a coronavirus. The common sipon, not all are coronavirus. No, 40% is coronavirus. So this one was a new kind. No, first time nakita, kaya ang tawag nila is novel. Novel means new. No, I think it's French, no, for new. So it's the new coronavirus. It's a newly discovered form of coronavirus. No? One that we first saw in China, and one that we do not know anything about muna, no? As then now we know some things about it. So factor number 1 is the quality, no? Is it a strong virus or is it a weak virus? Number 2, the quantity. How many of these viruses invaded your body? Okay? If it's 1 lang, di baka sampalin mo lang, mawawala eh, di ba? Kung 1 million, ay nako, you're in trouble, di ba? Ganyan lang yan, quantity. So may quality, may quantity. If the quality of this virus is very strong, kahit konti lang, kahit maliit lang quantity, baka madali yung host, di ba, o yung pasyente. Pero kung weak, no, it's a weak pathogen, and then konti lang ang dumapo sa host, baka wala talagang mangyari, no? So you see that that interplay of quality and quantity vis-a-vis factor number 3, or the immunity of the patient. Okay, strength of host. So like anything else in the world, no, there is a balance of balance of power here, no, balance of energy. One comes from the virus, the other one comes from you, no, or the patient. No? Let's say the patient is us or you, no, para mas personal. Kung malakas ang immunity mo, no, kahit anong quantity ng ng pathogen or invader, no, at kahit anong quality, you will be able to handle. Okay? But that's theoretical lang. Okay? Theoretical lang. Gets nyo, no? Gets nyo? Yung tatlong So one energy is yours, no? Your immunity. How strong are you? The second one is your kalaban, the invader. May quality, may quantity. Okay? I'm going to give examples of this. Okay? Okay. And I'm going to use, one of my hobbies, no, as I grew up, that's why I understand it quite well. One of my hobbies was martial arts. No? And the example I'm using is something that most of us know, no? At least know a little about, no? And I'll explain it to you para visually, no? You can imagine, no, what it is. Okay, so I will start off by giving you a test question, guys. Test question. Okay, you answer it. Question number 1. No? Jackson, you can put it out. Okay. Question number 1: is COVID-19 a strong pathogen?
It depends.
Yeah. So we're talking about no? Malakas ba tong COVID-19 na to? No, na virus. Diba? I was saying quality of the virus. Is it strong? Is it not? Okay. So you answer it. Is it strong or is it not strong? Okay. Okay. Siguro naman you have an answer na. Now, just so you know, for all those who got positive test for COVID-19, kung yung may exposure sa COVID-19, 2% of those will end up in the hospital. No? Moderate to severe, not naman critical, no? Mga iba nag-critical, moderate to severe illness. Okay? And the next one, next slide, is among all those who got infected, no, although 2% end up in the hospital, only 1%, or actually less than 1%, who are infected may die. Okay, may die. And normally, the people who die, di ba, are the elderly or those with comorbidities. Kung sino may ibang serious or chronic disease, such as number 1 is obesity, no? Number 2 is diabetes. Number 3 is hypertension, and number 4 is asthma. Okay, so if you have any of these diseases, the chances of you dying is higher. Okay, so kayo na hindi pa matanda or ill or with any comorbidity, no, you actually don't have much to fear. Okay, you don't actually have much to fear because only 1% ang namamatay. Okay, now if you think about it, no, only 2% will end up in the hospital. 90% is okay. Okay, mostly asymptomatic na.
Doc, excuse na sandali.
Yeah.
Miss Maglena Asido, kindly mute your microphone, please. This is a reminder lang, if you won't be able to mute your microphone, I'll be forced to ask you to leave.
Okay. Glenna. Okay, Jack, maybe we should, mute it.
Yeah.
Okay.
Jackson, you can mute them yourself po kasi you're
Yes.
the moderator.
Yeah, I know, but they have unmuted themselves.
Yeah. Okay. So the question again, no? Is COVID-19 a strong pathogen? I revert now to the boxing analogy, no? Let's talk about Pacquiao, let's say, as a boxer, because we all know who Pacquiao is, diba? And we all know how strong he is, no? So, question, is COVID-19 a strong pathogen? Next slide. Ang record ng COVID-19, no? Kung boksingero si COVID-19, ang win-loss record niya is 2 wins, 98 losses. Di ba? Dalawa ang ang nadadali, no? Now let's say everybody gets exposed, no? 2 will succumb to end up in the hospital, 1 might die, okay? Yung 98 is asymptomatic or will survive the no? In fact, most people who test positive, like me, I test a lot of companies today. Kaya medyo late ako ng konti, Dr. Tannen, Jack, because 2 minutes before 2 minutes before 2 o'clock, may tumawag na yung lung center, no? They need to test some of their patients, and I have to be the one to coordinate all of that. So I had to take that call. Sorry. Okay. But anyway, we go back. Ang win-loss record ng COVID-19 versus humans is 2 wins, 98 losses. Now you ask yourself, go back to that question. Is it a strong pathogen? Kung may boksingero na out of 100 fights, 2 ang talo, dalawa ang panalo, 98 ang talo, medyong banban yan di ba? He's not even, he might as well go bowling instead of boxing. Yeah? So my answer here really is, I do not believe it is a strong pathogen. It can infect, no? It's very infective. It's very infective. Droplet lang, no? Isang one sneeze or cough, you can get it, no? But will it kill you? No? Well, 98% of the time, you won't end up in any hospital. 99% of the time you will live, no? And actually, a little less than 1%, if you have the comorbidities and if you're elderly and your immune system is low, maybe you can you can succumb to the virus. Okay? The reason why I put this kasi is I see many people, some of my relatives pa, who are just so scared. No? They are just too scared that they change they change their lives drastically. Ang mga kaibigan ko na hindi na pwedeng bisitahin kasi, I come from the outside. What if the COVID is in the air, di ba? Hindi naman ganun No? Hindi naman ganun. What if you've been exposed and you come to the... Ngayon, if you're protecting the elderly, yes, di ba? Yes. If you're protecting the comorbid, be careful. Be careful. But then that's when we go to the next the next slide, no? So, answer, COVID-19 a strong pathogen? Para sa akin, hindi. No? 2 wins, 98 losses. Ang record. Question number 2. I have it also here on my side. Can we control the quantity naman? Diba? Una, yung quality. Can we control the quantity of COVID-19 that gets into us? technically it's called the viral load. Can we control the viral load? Answer, guys. May control ba tayo? Can we do anything to control the viral load of COVID-19 sa exposure natin? Okay. Answer is yes. Okay? Yes. And how do we do that? Yan nga. The thing that they always say, di ba? Wear a face mask para you do not share your droplets with others. And if others share their droplets with you, you will keep it away from your face. Why? Because pathologically, ang coronavirus na yan, yung COVID na yan, enters through the mouth, the nose, and through the eyes. Okay? So far, that's what we know. Can it be transmitted by blood? Not too sure. No. So far, parang hindi. No. And this came from a study where a COVID-19 positive mother, no, or pregnant mother, nung nag-deliver ng baby, yung baby walang COVID. Okay? Yung baby walang COVID. So, ibig sabihin, hindi blood transmitted. So far that's a study, okay? Can it be transmitted in the feces or urine? So far, none pa rin ang nothing set na in that regard. So, again, can we control? Yes, we can control. Mag-face mask tayo, di ba? Mag-frequent hand washing tayo. No? Kasi they say why hand wash? Kasi yung kamay ang nagta-touch sa mga bagay-bagay na may COVID, tapos yan din ang ginagamit pang-touch ng mata, ilong, mouth, and all that stuff. Okay? So, face mask, frequent hand washing, social distancing. Social distancing. Okay? So, the question number 2 on disease is, it is controllable. Okay? So, here we can control, but number 1, yung COVID strength, we cannot control that. Okay? Pero, be assured na it's not a very strong virus. Okay? It has a win-loss record of 2 wins, 98 losses. Okay? Now, let's see what's next. Question number 3. Can we control the host immunity? Can you control your own immunity? Siguro naman, you know the answer to that, di ba? Can we control the immunity of the host? The stronger the immunity, the more it can protect you. Okay? Kung mahina ang immunity mo, then the more you can get infected. Can we control the host immunity? The answer is yes, of course. Of course we can do that, di ba? And how do we do that? There are many ways, no? We'll discuss that later in the home care, management. Okay. So, klaro ba yan, guys? There are 3 aspects, no? In any disease, kahit hindi COVID, sabihin natin flu, di ba? Or any infection, TB, anything. If you know this thing, no? If you know the relationship between these 3 factors, you know how to deal with infections. Okay? You will know more or less, no, how infections work. And it is very simple. Quantity of virus, of the invader, the quality of the invader, and the strength of the immune system of the host. No? That should be very, very clear. If there's anything that you should bring home, no, a take home for you today, it is a relationship between these 3 factors. Okay? So if you notice, because we can only control the immune system of the host, and we can only control the quantity or the viral load of COVID, no? Where should our focus be? No? As a medical community, what should we focus on? There is what you call a medical intervention, non-medical intervention. Diba? Ang non-medical, katulad ng wear mask, wash hands, diba? Social distancing. Ang medical, ayan na mga all of this remdesivir, diba? Yeah, mga antivirals, antibiotics, mga lung machine, ECMO, what's that machine for breathing? Ventilators. Yan ang ano, diba? Pero if you look at how this goes, no, you'll see that mas important ang ano ang non-medical approach. Okay? At least when we talk about Western medicine, diba? The non-medical interventions are actually more important because it controls directly whether you will get sick or not, no? Or even if you're sick already. The others, you will notice, no, na in other countries, they prepared a lot of ventilators, no? Thinking na everybody will need a ventilator. But apparently, that was not the case, no? Yesterday, I was talking to the director ng internal medicine sa PGH, no? And kaklase ko yan no? And they prepared a lot of ventilators expecting most patients will be using ventilators, no? Pero hindi, that wasn't the case. That wasn't the case. In Italy, they noted that those who use when a patient is put into a ventilator, it's almost like a death sentence na, no? Mahirap na mahirap nang gamutin, or it'll be difficult already for the patient to return to normal, no, once there is once he's placed into an ventilator. And it became so obvious na as much as possible, although may mga ventilator sila, ayaw na nilang gumamit ng ventilator. Okay? Why? Because they see that it wasn't working well. Also because they didn't understand, or they didn't have access to knowledge on the pathophysiology, no, or how the virus actually infects, or kills a patient. No? Siyempre, una kasi novel nga, no, bagong virus, may lang, no. We had mga ideas as to what does it do, how does it kill you, no? How does it infect you, no? But now, based on more knowledge, 2, 3, 4 months of knowledge gathered, no, we know more or less how. Now, in my treatment, no, of COVID, you'll see na ang kasama ko ngayon dito is one of my patients. No, hindi. Ano lang yan? Model lang, okay? Okay, no. We will, I will tell you what is the present knowledge on how COVID works, okay? Next slide, please. Okay. In the TCM pathophysiology, no, of COVID, it says, no, in the beginning, no, it invades the lung. Why? It has this predilection for the lung. It likes the lung, no? And it enters through the nose, di ba? Straight to the lung yan. Nose or mouth. Kaya yung testing ng RT-PCR is swab sa nose, no? High, up here, nasal mucosa. Tapos meron din dito sa mouth. No? Hindi pwedeng stick yan all the way to the lung, no? Pero they do that because it is the lung that it first goes to, no? So the first organ it affects is the lung, no? Then it goes to the spleen. Then it goes to the stomach, and then the large intestine. Okay. Later I'll explain why that is very important, no, to understand. Kapag nandun na and you cannot control it pa because mahina yung immune system mo, the COVID will start affecting your pericardium, no, heart, liver, and kidney. Kaya kapag umabot na yan sa heart, liver, and kidney, ibig sabihin medyo seryoso na yan. Okay? Now, If you look at the mild disease, it enters the lung and it travels all the way to the large intestine. Okay. I have a question, a fourth question. I didn't write it down there. When you talk to people, anyone, including the medical professionals, when you talk about the respiratory system, what body organ are you talking about? Are you referring to? Siyempre, lungs, di ba? When we talk about the cardio system, the cardio system, we're talking about the heart, di ba? We talk about the renal system, kidney. No? When we talk about the immune system, what are we talking about there? Which organ are we talking about when we talk about the immune system? Many of you will know, no? Because you're good healers. I saw who were listening kanina, no? Many of you I know, and you're healers. When we talk about the immune system, we're talking about the intestines, particularly the large intestines. Okay? And it is not the structure of the large intestine, but it is the bacteria formed, no, or contained in the large intestine. It's that mixture, yung halo ng bacteria na yan, no? They call it the microbiota, no, of the small intestine. That actually, that large intestine, that actually dictates what your immune system will be. Kung puros basura, no, or bad bacteria in your large intestine, then your immune system won't be good, no. Which is why taking probiotics is a good thing, okay? Because it gives your intestines, you supply your intestines with good bacteria, your large intestine. That's the reason why in our clinic, also in Centro Holistico, we do a lot of colon cleansing. No? In colon cleansing, you take out most of the bacteria. Of course, not all will go out. Diba? Take out most, the good and the bad, and then replace it with the good. Diba? So ngayon, yung balance ng good at bad in the intestines is in favor of the good bacteria. Okay? That way, your immune system will be stronger. Okay? How do they know that? Do you know that there's this thing called the vagus nerve? You know? And if you go into reading the pathophysiology of this COVID, they talk about the vagus nerve being affected. And the vagus nerve is actually the nerves that come from the large intestine and go all the way to the brain. Okay? And from the brain, yan ang center ng operations. It then starts telling you, okay, thyroid hormones, you need this much, or bawasan, di ba? Your adrenals, do this and do that. It's a commander. No, it starts telling the body what to do. No, and because of that, your immune system gets stronger because it is united. It is fighting as one. No, but nanggagaling talaga sa intestines ang ano. Understand that. If you have time to research, because I cannot talk. I can talk a long time about this, but we don't have that much time to talk about this. Let's stick to COVID. But please try to research on what they call the gut microbiota. Okay, the gut microbiota. Okay, so you have to take care of the large intestines and the lungs. And you will see that when we get into the home care treatment of it, you will see that the lung meridian, the heart meridian, stomach meridian, spleen, they play a large role here. No? Okay, next. The main causes of death. Before, early on in the disease, the theory was people die of pneumonia. Yeah. They call it ARDS, no? Acute respiratory disease. ARDS. Acute respiratory distress syndrome. Okay, that is when the lung is filled with fluids. Okay, and they did the CT scan and all. It looks like pneumonia, no? Actually, even worse than pneumonia. Today, it is known that it really wasn't plain pneumonia, no? It was a combination of two things, no? One is called DIC, or disseminated intravascular coagulation, or yung dugo na nagko-coagulate. When RBC, individual RBC get together or they coagulate, their function diminishes, okay? And the flow of blood into certain areas are diminished or totally cut. And the second one is, the second cause of death is generalized inflammation. No? This goes already to the pericardium, to the kidney, to the liver. No? Kapag ganyan na inflamed na ang end organs na yan, dun namamatay na ang mga pasyente. Okay? So it's good to know, because in the treatment you will see that it addresses this thing. Okay? The main cause of death is coagulation, blood coagulation, and generalized inflammation. Inflammation of the whole organ system, not only the lungs. Okay? Okay, so you will see that the focus, no, is really now on the immune system. The focus is not on the medical. No? The focus is on the immune system, no? And as much as possible also with the non-medical stuff. Hi, Sunny. You have to mute muna, San. Okay? Mute mo muna. Okay, thank you. Okay, so focus on the immune system. TCM-wise, next slide, please.
Next.
Yeah. TCM-wise, this is how it goes, okay? There's 1, 2, 3, 4, 5, 6 points. No? 6 points to consider, no? And it's recommended. Kung kayo mismo ang pasyente, no? And you are at home, and you just want to, you're either recovering or you want to prevent getting sick, you can do moxibustion. You can do moxibustion on these points, and all of you know these points. Okay, these are very basic points. No? So you see in our basic course of acupuncture, these basic points come out. No, it's not only, these are the same points that the TCM world, no, the acupuncture world, whether it's in China or Europe or wherever, these are the same points we use. Okay, so there's much value in understanding this. No, so stomach 36, no, Susan Lee, you know that. PC6, leg 1, Li4, Hegu, all of these points, all of these 6 points, you can do moxibustion to strengthen those points. Okay, maybe about 10 minutes each point, no, with moxa. If not, kung kayo mismo ang acupuncturist of the patient, di ba? Aside from moxibustion, you may want to needle, no? With mild stimulation, kayong magni-needle itong mga stomach 36, PC6, Li4, CV4 and 6, and spleen 6. Okay? So acupuncture-wise, yan ang mga points. Okay? Now, the other TCM approach, you know, TCM is not only acupuncture. You know that na, di ba? Acupuncture and moxibustion. TCM, may tuina, may Qigong, di ba? May herbal meds. This is the Qigong, this is the tuina part of it, no? So meridian massage, it's that's what they call it. Kneading, pressing, rubbing, tapping of the lung and heart meridian. Okay, lung and heart meridian. No? You can either knead, no, go this way. How do you do that? Okay, kneading, pressing, rubbing, or tapping. Okay, tapping. Do you know what? You have to do that until it's a little sore. Yung spelling ng stomach ko, medyo siguro inaantok na ako. No? Hindi yan K, H. Okay? So, tapping. Okay? Kung pwede, until it is sore. Okay? Until it is sore. Mga 15 to 20 minutes yan. Okay? 15 to 20 minutes. Ganyan, ganyan. Okay? That's why you'll see there are some exercises talaga na ganyan ang ano, no? In the arms, it's the lung and heart. Okay. On the legs, it's the spleen and the stomach. Okay. The stomach below the knee, not here by the not by the thigh, below the knee. Okay. Spleen and stomach. That increases the flow of qi. Meridian massage increases the flow of qi. It increases blood flow, and it also increases the lymphatic drainage, especially the spleen meridian. Okay, we don't normally look into the lymphatic drainage too much, no? Pero importante din yan, no? Maybe one day I can give another talk, another lecture on lymphatic drainage. But before that, I want to give another lecture on something else. What will come up next? The next slide, Jack. Itong traditional exercises like Qigong, this is the one I want to show you one day in the future. No? So, Letty, if you're listening, no, we can schedule this this Qigong exercise. No? It's called 8 pieces of brocade. There is a link. No? If you can see, no, there's a there's a link, and Jackson, if I may ask, if you press that link, will we be able to get through?
No, Doc, it won't come out right now. But what we can do is maybe after your presentation, we can show a bit of it.
Okay, it's about 11 and a half minutes, no?
Yeah.
Yeah, maybe we can show that. Then on the 11th minute and 18 seconds, there is a summary, a written summary of what these things actually do. Okay. So I urge everyone listening. I think there are about 4,000 of us now listening. Is that correct? Yeah. After the we'll go through this link. We practiced this before, or I studied this a little before, but I never did it on a regular basis, so I forgot. Okay. So that YouTube ba? Tama ba yan? YouTube.
Yes, Doc. It's in YouTube.
Yeah, okay. So later, just review it, no, and see if you can download it. We will go through it. But I will make another presentation, no, through PAAI, another webinar, and you will see me do the magic 8 pieces of brocade. Okay, Qigong, maganda. It's it's good. It's easy. Easy to remember for most people, but because I am already 61 years old, no, I cannot remember that very well. Okay, so I will have to follow that. But then I will show you one time. I have to look for costume muna para mukhang authentic. Okay. Okay. So we have acupuncture. We have meridian massage. We have traditional exercises. The one they recommend is 8 pieces of brocade. No, it's called Badwanji Qigong. And the last will be on mental health. Okay, on mental health, as a intervention for treating COVID at home, is you do the auricular points. No? One of which I think will be the NADA protocol. No? This is not the NADA protocol was not the one that was recommended. They didn't recommend any protocol. They just said auricular points. No? And I am most familiar with the NADA protocol, and I think it will work well with COVID. Okay. Then you can do massage also. The proper way of doing massage is the effect is stimulating. Diba? It makes blood move. It makes qi move. No? You don't entrap it. You disperse the qi. And then there are herbal teas. The herbal teas to be used, although they came up with many Chinese herbal teas, I don't know many of them. No? So these are the herbal teas that relax you actually. No? And then music. Music helps a lot too. No? It's for relaxation. Okay, it's for relaxation. Okay, now do I have anything nutrition wise? Okay, nutrition wise, ito na yung integrative part ko, no, na hindi naman nasama sa official protocol, no, TCM approach to COVID, but this is where my my practice comes in, no? My personal practice, and those who practice integrative med. No? Nutrition is very important. Okay? May herbal medicine din sa no, na the Chinese official protocol gave us, but again I don't understand what their foods are. So we use what we have over here. So nutrition wise, you stick to whole foods. Okay. Fruits, vegetables, kung pwede nga fruit in season, vegetable in season. Okay? Whole grains and unprocessed meats. Hindi naka-can, hindi naka-preservative and all. Okay? And then always take adequate water. I will give you a 1-minute talk on water. Okay? Water is needed for all our detoxification. No? Our body detoxifies in 5 normal ways. We sweat, no? Urination, stool, the mucous membranes, and respiration, no? When we breathe. All of this is how we detox our body. And all of those 5 methods, no? Natural methods of detoxification, all need water. So if you do not have adequate water, you will not adequately detox your body. Kumbaga, eto na yung basurero sa labas, hindi mo ilalabas lahat ng basura, no? Iiwanan mo mga iba sa loob ng bahay. That's not good, di ba? Something wrong will happen over there, no? It will stink, no? Just like your body will, no, figuratively stink if you do not take out all the basura. Okay? So water, very important. Number 2, aside from whole foods, is you avoid the following. Number 1 is processed food, whether it's instant or fast food, cured meats, canned goods, and foods that are high in sugar. Okay? There are times that we have to, parang we have no choice, di ba? Na kung pwede nga yung chicken, free range, di ba? Pero saan mo makukuha ang free range chicken? Diba? Malayo ka sa range, no? Mahal ang free range chicken, mura ang regular chicken, mas malaman pa. Di ba? Things like that, eh. No? So you end up doing, getting chicken that has been fed all of these antibiotics and hormones. Instead of instead of 18 to 24 months to make a adult chicken, 28 days na lang yung chick na ganyan naging no, dambuhalang chicken, no? So try to keep away from those as much as you can. Also canned goods, kasi the lining of the canned goods has cadmium, lead, sometimes may konting mercury pa, di ba? So all of those things are not good. Tin, di ba? All of those are not good. I see someone smiling at Jake Alberico. Hi, how are you? That's a nice smile. Okay. Anyway, so yeah. So avoid processed foods, cured meats, canned goods, no, and sugars. Sugars are very inflammatory. Okay. Supplements wise, this thing talaga, please remember it. Okay, because we've been trying to push this. In fact, some of our doctors do this. No, they really push this. Even in hospitals, okay? Vitamin C, if you're just preventing, no, then you do a vitamin C, 1,500 milligrams daily. No? Ako, I do 3,000 milligrams. I don't want all of you to take 3,000. I want you to study it muna. No? Me, I can take 3,000 milligrams. Sometimes I even take IV vitamin C. No? If there's one vitamin that you take that really helps you build your immune system, it's vitamin C. No? Number 2 is vitamin D. For me, although vitamin C is the best that you can take. For me, vitamin D3 is the best overall. No, but this is best taken from the sun. Okay. So part of healing or prevention is getting enough sunshine or enough sunlight, no, in your body. 20, 30 minutes a day, no? Kung pwede nga, walang damit, eh, no? The more exposure, the more skin exposure you have, the better, di ba? Kung masyadong matindi ang ang init ng araw, then you don't have to stay too long, di ba? Pero as much as possible, get that vitamin D. Okay? You will notice that if you look at the world, no, that the Earth, and then there's an equator. The equator is a part of our Earth that is closest to the sun. Yan ang pinakamainit, eh, no? You will notice that the incidence of cancer, the farther away you go from the equator, the higher the incidence of cancer. Okay? The farther away you go from the equator, the higher the incidence of cancer. The closer you are to the equator, the less cancer there is. Why? Because of vitamin D. Okay? Now, if you cannot get enough vitamin D, because in general, in the Philippines, ang mga babae, takot sa takot sa araw yan, eh, no? So, yeah. So, just in case, okay, just in case, you can get vitamin D3 supplementation. No? About 5,000 IU. Some people say 4,000. I stick to 5,000 IU a day, no, as a supplement.
3 months.
Okay, for at least 3 months, until such time that your optimal range in the blood test is between 60 to 80 nanograms per milliliter. Okay. So you can test. If you test and you're already good, eh, wag ka nang mag-supplement kasi may kamahalan nata yung vitamin D, no? Kung if you want to save money, then you just go under the sun, libre pa. You know, the funny thing is, in order to be healthy, the most important things are all free, actually, no? Good water, sunshine, diba? And then the vegetables, natural vegetables and fruit that you'll see you'll see around. Once you start getting processed foods that have been already manipulated, no, by human beings, na yan, low quality na yan. Okay, low quality. Okay. Second to the last is zinc. No, zinc increases your immune system by promoting all the healing qualities, no, of your cells. So try to take zinc on a regular basis, no? About 30 to 50 milligrams a day. Dati nagfa 5 milligrams lang ako until I studied it and they said minimum 30, no? Especially if you're trying to prevent yourself from getting sick. So in this time of COVID, mag-30 ka na, di ba? 30 to 50 milligrams a day. Last but not the least, in fact, one of the more important is turmeric, di ba? Mas maganda kung may piperin. If you go back to the slide that says what is the cause of death, no? The two causes, the main causes of death is two: coagulation ng blood and inflammation, generalized inflammation. Do you know that turmeric controls both of them? Okay, turmeric is one of the most potent anti-inflammatories, natural substances that you can take, okay, that you can find. Again, you can plant it anywhere, libre na naman, no? Kung hindi, humingi ka lang sa kasi it grows everywhere. Dito sa bahay ko, kung saan-saan lang tumutubo, no? Kasi last time we planted, now it just grows anywhere. We want to just pull, no? May turmeric na. That is an anti-inflam. Another effect of turmeric is it's an anticoagulant. It's a blood thinner. Parang aspirin. Parang aspirin. Kaya lang aspirin, may side effects sa gastric lining ng stomach, no? So if you want to prevent the main causes of death, which is inflammation, no, and coagulation, there's no better supplement than turmeric. How much turmeric will you take? How much turmeric will you take?
500.
One capsule normally is 500 milligrams. No, you take it maybe 3 to 6 times a day. No, so either 1,500 to 3,000 milligrams a day. If there's anybody in your house that's you suspect of having been exposed to COVID, then you can increase it from 3,000 to 6,000. No? You will know that sumobra na ang dose mo dahil maninilaw yung skin mo no? Just bring it down and you'll be okay again. Okay? So please take turmeric, zinc, vitamin C, and vitamin D. Okay? Now, guys, look at this. This is my final word. I talked to you earlier about the pathogenicity of COVID-19. And I talked to you about the viral load and how it affects the host immunity, di ba? Again, kung malakas ang pathogenicity, kung malakas ang COVID, kahit konti ang viral load, kapag mahina ang immune system ng host, madadali ang host, yung pasyente, di ba? Pero kung malakas ang immune system ng host, kahit malakas ang pathogenicity, ang strength ng COVID, maaring i-prevent pa yung infection. Okay? So there is a formulation here, no? Dapat ang host immunity is stronger than the strength of the pathogen and the quantity of the pathogen combined. Okay? Now, I will go back to the boxing analogy, di ba? Si Pacquiao. Next one, please. Si Pacquiao. Now, there are many women in this group right now and you might not know who these people are, no? Pero itong mga kalaban ni Pacquiao dati, si Morales, most of them, except for Mayweather, most of them are mga national hero ng Mexico yan, no? Pero binanata ni no? Kasi as much as they are strong, Manny Pacquiao was stronger, di ba? Malakas nga si Barrera, mas malakas si Manny. Kaya panalo si Manny, no? Si Marquez beat Manny once, but Manny beat Marquez twice. De La Hoya, the one who sponsored Manny, no? It's his De La Hoya production, no? Siya may-ari ng boxing match na yan, no? Sabi niya, he thinks he can handle Manny. Well, round 1 lang ata, talo na no? Talaga ganyan yan, no? Si Mayweather, he beat Manny supposedly, no? So it's possible, no, that Manny can lose, no, because you can be strong, no. But if the pathogen is much stronger than you can lose pa rin, no. Kaya natalo din si Manny, no. Then when it comes to the viral load, look, so if Manny gets each of those boxers one by one, most of the time, no, he will beat them. He will beat them 4 out of 5 times. However, if the viral load is high, meaning sabihin natin lahat-lahat 5 sila, no, sabay-sabay, they will fight Manny Pacquiao, no, in one ring. Edi sinong matatalo, di ba? Then si Manny ang matatalo dun. Gets nyo, di ba? How strong and how many? Kung isa-isa lang ang fighter, mananalo si Manny, except for Mayweather, di ba? Kung sabay-sabay, the viral load is high and their pathogenicity is high, kahit ganong kagaling si Manny, mamamatay. Matatalo din yan. Okay? Now, this is where, the next slide is where, while I was walking 3 days ago, this thing came into my, no? This was a blessing from the Holy Spirit, no? We'll talk about faith and trust in the Lord, okay? Because when we talk about healing, we're not only talking about the body, no? In fact, the body can go anywhere it wants to go, no? As long as our spirit, our soul, at the end of our lives, we know where we are going, diba? And we all want to go really to heaven, diba? We want to go. Do we know how? This is the revelation that I had while ang virus, there are many viruses here on earth, no? Such as pride, fear, anger, greed, unforgiveness. What was the one I mentioned last night that I wanted to put with fear? Anyway, Anxiety. Yeah, there was another one actually also. Worry. Yeah, worry. Okay. Fear and worry. All of these are viruses that affect our spirituality. Diba? And if our faith, no, and if our faith and trust in the Lord is not very strong, pride might take over us. Diba? Fear might take over us. Anger might take over us. Greed may take over us. Unforgiveness will linger with us. No? And depending on the frequency and exposure, no, and intensity of these viruses, these pathogens, no, in our lives, baka we might fall into the trap, no, of the evil side. Which is why aside from being good healers, no, we have to always be connected, plugged, always being recharged, no, by the Lord's word, His faith, our faith and our trust in the Lord. You know why? I noticed that during these times of COVID, there was so much worry, no, so much worry. I grew up in a family that said, when you worry, you're actually telling the Lord that you do not trust Him. Okay? Do you get that? When you worry, you're actually telling the Lord that, Lord, I do not trust you, kaya I will worry. No? Because I'm worried that you might not help me. I'm worried that you won't be with me. Ganyan ba talaga? No? We are a country of, 90% Christians. We profess to have strong faith in our Lord, but many times we worry. I see that. Many times there's so much pride. Well, you can brush that aside and say, we're human beings lang, no? Tao lang kami. Yes, you are, no? And yes, we are. That's the reason why nga we have to trust the Lord more. Kasi tao lang tayo. The Lord is God. Okay? He made you, me. He knows what you're thinking of. Diba? And He loves you to the point that He will protect you. You ask for His protection. No? You ask that He enter your heart and never leave you. And He will enter your heart and He will never leave you. No? So again, if the small things in life will give you worry, if the small things in life will make you angry, no, will give you fear, will make you greedy, the small exposure to greed or whatever, that the small things, if they will give you pride, fear, worry, and all, that only means that your faith and trust in the Lord is small also. If you want to take over talaga the fear and worry that I see all around happening, no, then have more faith, no, have more faith in the Lord. Pray, no, pray for His, for His coming into your life. Yeah, I want to close this session with a prayer. I hope you really don't mind, because as I mentioned earlier, aside from leaving a piece of my mind with you, I want to leave a piece of my heart. No? And this is it. This is it. No? I hope you forgive me if you get offended. I hope you don't. No? And I'm asking your permission if I can pray for you and I can pray for us collectively in these times of trials. Okay? So let's all give 1 minute to this. No, we pray. No, Lord, you mentioned that whenever there are 2 or 3 people together, gathered in your name, that you will be with us. Now we're about 4,000. No, joke lang, 40. Okay, we are 40 lang. And I know you're with us, Lord. We are, wow, number. We are 88 pala. Okay. I know you're with us, Lord, and you're guiding our hearts, no, as healers in this.
Ito po yung sa... Ay, meron po...
Lord, forgive us our sins, no? We are human, we sin. Please forgive us our sins. We try not to do this intentionally, but because of our innate weakness as human beings, we keep on doing it, no? So we ask you, Lord, to enter our hearts now, no? Be with us now, Lord, no? Come into our hearts, stay with us, strengthen us, no? Enlighten us, give us your, pass on to us your gift of healing, knowledge, wisdom, no? Stay with us and never, ever, ever leave us, Lord. And we pray, Lord, that we're able to pass on our knowledge, our healing, no, to others as well. We're sorry, Lord, for all of our transgressions in the past. We will strive to be better people. We will strive to be better healers. Stay with us always, Lord. Never, please, never leave us. Okay? We pray this in the name of your Son, Jesus Christ. Amen. Amen. Guys, thank you. Okay, thank you for spending some time with us today. I will really open this thing to questions. As I said earlier, I want more questions. I know I talk a lot, but I want to listen to your questions. If there's anything you want me to do for you, no, to pray for you or to share with you, you can always text me. No, we can always speak privately if you want. But for now, Lord, thank you for this session. I thank you all for all the 88 people gathered here. I hope this session was good for you, no, and that you learned. Let's go on, let's go on healing people. Let's go on sharing, and have a happy day. Have a happy day. No? Okay. Thank you. Thank you.
Thank you very much, Doc Mikey. We can now open for questions. Maybe you can start typing your questions in the group chat and Doc Mikey can check on them one by one. Doc, is it okay for me to close the...
Yes, please.
Okay.
Yes, please. Yeah.
Okay. Let's give them a minute to type in their questions.
Mike, can I say something?
Yes. Who's it?
Yeah, we have to
Oh, there. Yeah, Dr. Tan, yeah.
Congratulate you for a very enlightening, lively, and very spiritual, lecture. I think it's very holistic lecture. Congratulations, and we learned a lot. Congratulations. Thank you. God is our number one healer. Yeah. How about maybe while we're waiting for the question, how about the video of the part 1 Chin?
Oh, nga pala.
Yeah, Jackson.
Yeah, okay. Sige, we can...
While we're waiting, let's have a movie muna.
Yes, you can.
In fact, early last year we had a workshop on it. Last year, there was somebody from China who came. It was organized by PAAI. Di ba, Jackson?
Yeah, it was organized by our very own Dr. Tan So Chong.
Okay. But this time, not all the way from China, all the way from Paranaque. Okay? You will see. You will see.
Oh, yes.
Yeah, hold on for a while. I'll just look for the link.
I'm saying hello to Crisia Erica Pailago from Canada. Okay. Yeah, okay.
Hi, Doc.
I'll wear my eyeglasses now, huh? I cannot read anymore. Hey guys, thank you. I'm reading here. Emmeline, Naomi, Galaxy 830, Tess, Jennifer Dizon.
I don't think it can play pala over the air from YouTube right now.
Cannot.
Yeah, it's not sharing.
You-
What
can you
I'll
check
do is
again?
I'll just copy the link na lang.
Yeah,
I'll put the link here.
yeah.
I'll try it one more time.
Okay. Ooh, parang okay ah.
Lumabas po ba? Do you see it?
Yeah.
Ah,
Oh,
okay.
I can see.
Okay.
Yes, kaya lang maliit.
Yeah. Okay. This is about 12 minutes all in all. Ah. On the 11th minute and 18th, it gives a summary. This is called the heavens, This is called two hands hold up the heavens. It's used to regulate the triple burner. Yeah. Or the triple energizer. That's not me, ah. Shave na ako.
Mas pogi si Doc Mike.
Oh, nandun ako sa sailboat.
Doc, ikaw yata yung nasa sailboat na.
Oo nga, oo. Nakatala ko yan. Okay. It's a little slow, no?
That's how
Yeah, but it's about like that 12 minutes a day. Once a day lang to eh. No? See? That was easy, di ba? That's not a hard exercise. That's called two hands hold up the heavens or holding up the heavens. Then you ground yourself again. Get your chi, put it in CB4 and 6, and then ground. This one is nice. It's called drawing the bow to shoot the bird of prey. Okay? Bow and arrow, drawing the bow to shoot the bird of prey. This is used to improve the lung and the liver. Lung and liver. Mind you, this is the exercise, the Qigong exercise that is recommended. In a couple of months, ako naman ang gagawin yan. Tapos you follow me in your houses. Gather chi, internalize, ground. This one is called, it's going to be written there, separating heaven and earth. Separating heaven and earth. This is used to adjust the spleen and the stomach. Spleen and stomach. Okay. That was the third set. There are 8. This is interesting. The wise owl gazes backward. Proper breathing, the inhalation and exhalation. You'll see it is a very simple movement, no? And yet this movement is the Qigong exercise that would prevent disease and injuries. Prevents disease and injuries. I think if you do these exercises, you won't even sweat. Okay, quite simple. The fifth exercise is also interesting. Shake the head and swing the tail. Shake the head and swing the tail. Okay. This exercise removes fire from the heart. Yeah, for those with hypertension, it expels fire from the heart. Or those who are yung masyadong galit. Deep, deep breathing. Number 6 exercise. Massage the kidneys and reach for the feet. Ito, kailangan ng konting stretching. Kidneys, massage down. Then as you bend, the kidneys are also stimulated. Strengthening of the kidneys. This number 7 is very important for to improve your strength and the chi. And you'll see why. Look, punching with strong, focused eyes. Get the chi from your from below your belly button. Tighten your stomach muscles. Pull and push. Take a deep breath. Pull and push. That strengthens your chi. Siguro in our next PAAI General Assembly, ito yung exercise natin after lunch. The last one is called bouncing on the heels. Bouncing on the heels. This is easy. I tried it last night. I almost fell down. Yan lang. Ganyan lang. Tiptoe down. Bouncing on the heels. This is done to prevent and to cure illness. To prevent and to cure illness. See, sir, if you look at all the 8 exercises, some are very easy like this, no? Yan, kayang-kaya kong gawin yan. The others you need to kind of memorize, diba? A little bit lang. But you'll see, for 12 minutes a day, you can strengthen yourself and strengthen your immune system. Yeah. Ngayon, it's gonna bounce, huh? Watch this. Yeah. Parang letting go, letting go. Okay. Gather again. Ground. Okay, here. So this is the 8 pieces of brocade. Ang ibig sabihin ng brocade is like a tapestry. Kung baga you have 8 different threads, no? That you weave. No? So it's a weaving of exercises. All 8 weaving exercises will make you a tapestry that is your immune system, no? That is strong. It makes it strong. Okay. This is the Qigong exercise prescribed, no, in home care, the Wudang Dao production. Okay. Okay. That's it.
Okay, Doc. You have a lot of questions na.
Talaga? Oh.
Yeah.
Okay.
Can you see the chat box, Doc?
Yeah. Yeah. But so far, were the questions? Huh?
Sa huli mo. Ay, I'm sorry.
Around 3:20.
Hi, sorry.
Hello.
I saw me. There. Just move it down.
What time best for sun exposure? Okay.
Then you can move it.
You can actually, the best time for sun exposure is whenever you have time. If it's in the early morning or late afternoon, then you're then you hindi masyadong it's not too hot, diba? It's not too uncomfortable, but you have to stay longer. The hotter the sun, the less time you can stay under the sun. Sabihin natin tanghaling tapat or 2 o'clock, no, in the afternoon, then you stay for about 15 minutes. But if it's about 9 a.m., 5 p.m., 4:30, ganyan, then you can stay longer. Maybe 30 minutes. Diba? Again, the more skin exposure you have, the better. Para you absorb the vitamin D.
Doc, excuse.
Yes.
Do you have another speaker on or a phone or another?
No.
Kasi you're having echo.
I do, huh?
Yeah.
Okay, I don't think so. Is my phone on? No, I don't.
Wala. Doc, medyo naka-mute ka.
There.
Yeah, there. Okay.
Okay. Yeah, something happened siguro sa ano.
Next question.
Yeah. Nice to see all of you. Okay.
Up and down. 2 fingers.
The next question is, thank you. Okay.
It's the end of it. You move
Yeah.
down, so it moves up.
Okay. The turmeric, somebody's asking about ano, no? 1 capsule 3 to 6 times a day. Yes. If you do 1 capsule of turmeric 6 times a day, you might as well take 2 capsules 3 times a day, no, for easier compliance. That's the dose of piperine, no, with turmeric is the ratio is 99 to 1. Okay, 99% ang turmeric, 1% ang piperine. So it's not too much, no? Siguro isang 1 peppercorn lang of black pepper, no? Pound it and mix it into your if you're going to make a dish, a food, no, then you get more than 1 peppercorn, no? Maybe you get 6 to 10, no? Dikin tapos isama sa food. Okay? Make sure, of course, that it is really pepper. Diba? Kasi maraming fake na pepper, yung buto ng papaya ang ginagamit eh. Diba? Walang piperine yan. Okay. Now, there's a long question here. Let's see, from Mariam. In connection with the DOH and WHO reports, is it just right to say that flattening the curve is already attained, despite increasing huge number of confirmed COVID positive cases? You know, I don't think the flattening of the curve here in the Philippines has been obtained. It has in a little sense, no, that it in the Philippines, we're one of the few countries na walang spike, no. There is no increase, no, yung sudden increase of cases. There has been a steady increase, not naman flat, it's still slanted upwards, no, but there is no spike. And that is a good thing, no? Despite our kapalpakans, you know, we're not perfect. I'm actually happy with the result of what's happening, no, in the country. As you said earlier, Dr. Mikey, no amount can still equate natural ways of boosting our body's immune system than any allopathic drugs could bring. Yeah, we are blinded here. You know, the problem with doctors is they like to give a cure that's what we call sexy, diba? They want to give a cure na medicine or high-tech this, high-tech that, whatever, no? Hindi talaga kailangan eh, no? Hindi talaga kailangan. If they're only more, what should I say, spiritually grounded, no? They will know that there are other ways of treating, no? And they will know that the natural ways, the ways that the Lord provided for us are actually the best ways. What is it that man has in his proud brain that thinks that he can make something better than the Lord? Diba? Not really. At least with me, no? I don't believe that that he can make anything better. It's for us human beings to discover what is it that the Lord has given that we can use for this or that. That's what makes life exciting, diba? You explore, you study, you discover things. Okay. Let me see other. Especially those who really want to give their help are people fighting against this government. What is your position to give such help? What? Especially those. Sorry, I'm reading another. As an acupuncturist, especially those who really want to give their help, our people fight against this COVID crisis. What is our position to give such help? Meaning, if we help acupuncture-wise, no? Yes, I gave six points, no, to help. Let's help in the home, no, and make sure that the patient actually approves of us helping, you know, because although we live in a society that is limited, no, and it has rules and regulations. The DOH has rules and regulations, and it's not yet normal, or it's not yet part of the protocol that acupuncture should be used for treating the COVID. No, we are in PAAI, care of Dr. Tanchochong and Dr. Alagaya. We are trying to come out with our own protocols, no, based on the suggestion of the international acupuncture bodies, no? on how to treat, and we're going to test it. We're in the process of doing our research there. Okay. So yes, please, no, if you're at home, help by treating people. Remember, guys, the acupuncture needle is only an instrument. No, you are also an instrument. The healer is somewhere up there. Okay, so you do anything you can. No? If you don't have needles, use your finger, diba? But pray to the Lord and have the Lord use you as the healing instrument. No? Kahit wala kang acupuncture needle, so gamitin mo yung finger, go, Lord, itong point for you, no? For the healing of the patient. Okay? I believe that a lot. Kayo ang healer, okay? Or you're the one with the healing gift. What is your position of Dr. Fabunan's antiviral? There are many antiviral, no? Antiviral medicines. Garlic is a very strong antiviral. Turmeric has some antiviral qualities. Cinnamon has some antiviral qualities. Onions have antiviral qualities. No, there are many. I'm not sure exactly now what he uses. The thing there is, don't make outrageous claims. Okay, and then worse pa, if you put your name behind it, parang may ibang no? Parang iba na yung motive mo eh. No? Dr. Fabunan's magic antiviral medicine. Parang hindi tama. No? There used to be a law before where doctors cannot even advertise their services. No? And there was also a law before that said when the doctor puts his name outside the door of his clinic, it shouldn't be more than 1 inch high. You know that? Ganun dati ang That's how strict it was eh. No? Si Belo lang ang naka-break ng strict na na yan eh, because he came up with a big poster in EDSA that said Belo, di ba? And when she was asked to take it down, she goes, no, that's not my name, that's the name of the company. Di ba? So may technical dun, no? You can advertise if you use the name of the company, but you cannot advertise if you use your name. Name ng company niya, Belo. So after that, things became very, very lax. So by putting your name under something, for me, that's not right. I might be old-fashioned, but that's how I was trained. Other countries like Thailand are opt to have clinical research on it to fight COVID. Okay, just wondering why our government, instead of helping our very own to develop such medicine, could be of help. I know we're looking into a number of our local meds, including VCO, as usual. VCO is always there. No, turmeric is always being used as well, and there's another one that they're thinking of using for vitamin C. No, we're doing a lot of trials also on that. In PGH alone, there are more than 100 trials going on. Different things. Okay. Now, I'm looking for more questions. Doc, I have morning habit drinking 5-in-1 organic turmeric tea with malunggay, ginger, sour sop, lemongrass with brown sugar. What can you say about this drink? I think the drink is perfect except for the brown sugar. Okay. Malunggay, ginger pala has lots of zinc, diba? Kanina I mentioned that one of the most important minerals for the immune system is zinc. Ginger, white ginger, no? That has a lot of zinc. Okay. Lemongrass is good. Ginger, soursop is good. That's soursop is guyabano. Okay. Guyabano is a very strong antioxidant, no? Some people think, like mangosteen. Mangosteen is a very good antioxidant as well. Very high ORAC value. But guyabano has even a higher ORAC value than antioxidant value than that. And turmeric. Okay. I wish though that the turmeric tea you're taking has a little pepper. If it has none, kindly put some. Okay. Less brown sugar only. Yep, less brown sugar. Any more questions? I don't know if I saw everything. Can we find this Qigong exercise in YouTube? Yes, you can. It's called
8 brocades.
yeah, 8 brocade. 8 pieces of brocade. Okay? 8 pieces of brocade. 8 exercises that when done together will increase your immune system, the strength of your immune system. Let me see. How many minutes do we need to stay under the sun? Again, it depends, no, on what time. Anywhere between 15 to 30 minutes. When you're gardening, di ba? Stay under the sun, garden. Alam mo, since the lockdown, I planted so many things, no? May balag na ako eh. I have passion fruit. I can see it now eh. I planted okra and kamatis, eggplant. Yung garden ko is ano na eh, kalabasa garden na. May papaya ko, may dragon fruit. Ang dami kong tinanim talaga. No? I suggest somehow, no, if in the future we might have problems with food security, you start planting your own stuff na, or at least learn how. Let me see. More questions, more questions. Oops. You guys have more questions? Para
Doc,
I cannot see.
there's another question at 3:46 p.m.
Okay, 3:46. 3:46. There. Oh, here. Okay. Okay, Gladys. Kamusta? I have a friend working on board, so limited lang ang medical sources and supplies. 1 month na siya inuubo. The doctor on board meaning on a boat, I guess, no? On board, gives him antibiotics for a week. Still coughing, no fever. Not difficulty of breathing. Then doctor give him extra antibiotic plus fluimucil, okay? And acetylcysteine. He said he is better, but still a bit cough, but he's suffering pain on his ribs. The pain on his ribs is because of the constant coughing. Aside from alternative medicine like luyang salabat at gargle water, warm with rock salt, it helps somehow. What can you suggest to relieve pain on his ribs? Well, the less he coughs, the less pain he will have in his ribs. You know? So you might want to focus on his cough. Now, the problem with cough and cold is normally, kung may sipon yan or may postnasal drip, no, there's congestion of the nasal mucosa. Yung mucus dun, yung nanggagaling sa nasal mucosa, it will go back to the it will drip here at the back, no, to your throat. It's called the postnasal drip. At the back of the nose, it will drip. Tapos it will irritate the throat and we will cough. No, this is a regular reflex of the body. No, so ang ginagawa ng mga iba is so they have this cough and cold and they take cough medicine. But the cough medicine only is here. No, ang problem dito sa ilong eh. No? So my suggestion always is if there's somebody with a cough and cold, you take out the cold. No, you focus on the cold. When there's no more cold, no more sipon, there's no more drip at the back. And when there's no more nasal drip, there's no more irritation of the throat. And when there's no irritation of the throat, there's no more cough. Okay? So if there's a cough and a cold, you take a cold medicine. You take a decongestant. Okay? It will stop the cold, it will stop the drip, it will stop the cough. Okay? So if he has no medicines, to take out the pain in the ribs, you can put a warm compress and slight gentle massage. Or you can put even a cold compress or something like Vicks VapoRub, diba? Just to relieve the pain in his ribs. Or take an anti-inflammatory, better turmeric than non-steroidal anti-inflammatory drug. Okay. Okay. Okay, that's it. 8 brocades, exercise. Okay. Why is government eager to wait for vaccine from pharma to be mandated and implemented then? Okay, Mariam, listen to this. Ready? Listen to this, huh? I can lecture, now one who lecture on this. The world is trying to look for a vaccine. In fact, there is a race to look for a vaccine. No? Why? Because the first one to come up with a vaccine will make billions and trillions of dollars. Okay, one. They're making a vaccine against coronavirus. Okay? There has not been any vaccine on coronavirus in the world, in history. Okay? May vaccine ba sa sipon? It's called the common cold, and yet there is no vaccine for that common cold. Diba? Why? Because it's difficult. Why? Because the coronavirus keeps on mutating. There is a, there are some flu vaccines, okay? But if you notice, every year you have to change the flu vaccine. Why? Because it keeps on mutating. And aside from the mutation of the flu virus, there are many strains. So the way they make flu vaccines in the world now is they get the 3 most common flu viruses of last year, of 2019, and they make a vaccine for that. At yan ang binibigay sa 2020. No? The 3 most common of 2019. Eh kung nadapos sa iyo yung 4th most common, ito may flu ka pa rin. Di ba? So they're just playing with the numbers there, no? That the most common are the then they make it. So you will see that even the SARS, which is a COVID, no, that's COVID-1 virus. Walang yan, walang vaccine, no. The MERS, the Middle East, no, yan, wala din vaccine yan. Wala talagang vaccine sa virus. However, now they think that they can have one. Okay? Now, let me tell you this, ang vaccine, normally, what they do in vaccines, no, I'm not anti-vaccine, I'm not anti-vaccine. There are many good things. Polio, di ba? Smallpox, lahat yan, nawala, no? Why? Because of vaccines. Tama yan no? However, this one is quite dangerous, okay? Normally, what they do is they get the virus, no, and they weaken the virus, or they get a bacteria and they weaken the bacteria. In short, they weaken the pathogen, no? Live yan They weaken it and then they inject it, no, on you. So you have a weak response also to it. Diba? That means you make antibodies already, no? The reason why you want to make antibodies to a certain disease is para kapag dumating na naman sa iyo, your body, your defense mechanism knows that it's there, no? Kilala na niya yung invader, diba? So it can produce antibodies and fight it immediately. That's why the new coronavirus did some harm early on. Kasi bago nga, new, nobody has any antibodies against it yet. Diba? So when it comes, you know why the elderly get more seriously ill with the COVID? Because when you're young and there's a germ, there's an invader that gets into your body. When you're young, your body produces antibodies very quickly. No? Ang bilis niyan. And it fights already it fights the invader. Okay? Kapag bago ang invader, it will step back muna and say, is this new? No? Is this part of my body? Is it natural or not? No? It says, hindi to natural no? Galing sa labas to Then your body starts So it takes a couple of days. Okay? It takes a couple of days if you're young. When you're and then When it comes again, eto na. Kasi our body has what you call memory cells. Okay? So when you're exposed to the thing again, you can immediately make your antibodies. Wala nang tanong-tanong na ano ba to? Is this a foreign body or not? Diba? It's there immediately. I know that. No? Nakita ko na yan 3 years ago. No? Ito yung doon. Ito yung antibody against it. Yan. When you're older na, it takes a longer time for your body to respond. Okay? So, let's say there is a 20-year-old person and an 80-year-old person that both get the COVID, no? So it's the same quality of COVID and it's the same quantity of COVID. Diba? We talked about quality and quantity. So the viral load is the same sa 20-year-old and sa 80 years old. It takes 3 days, sabihin natin, for the 20-year-old to make enough antibodies to overcome the virus. Okay? Habang in the 3 days of the 20-year-old, the virus will start replicating inside the cells. No? It starts, dumadami yan sa katawan ng pasyente. No? Pero bago dumami masyado, may antibody na si 20-year-old, patay yung No? Yan. The 80-year-old is different. No? So the 80-year-old, it takes, let's say, 9 days for him to make the antibodies. So ito si virus, no, with the same viral load as a 20-year-old, pero it keeps on producing more and more and more. On day 3, it's the same as the 20-year-old, pero wala pang antibody yung 80-year-old. No? So it keeps on producing more and more and more and more until it gets so big, no? Hindi pa activated yung antibody ng 80-year-old. No? When his antibodies come out, wala na, masyadong marami na yung virus eh. So natabunan tuloy yung yung sa matanda, 'di ba? That's how it is. The antibodies come out later, no? With the elderly. That's why the elderly have a hard time, no? That's why the elderly are the ones that get sick and they're the ones that die. If you have a comorbidity, same thing, because your immune system is weak, no? So when the virus attacks you, matagal before you respond. That's why elderly, you have to take no? You have to have extra precaution. And you will see that the key, ang pinakasusi dito is your immune system. So even if you're 80 years old, no? But your immune system is strong. That's why not all 80 years old die. There was a 100-year-old woman, I think 104-year-old woman, no, who got COVID, no, ended up in the ICU. She actually recovered, no, and she was sent home. 104 years old. Why? Somehow her immune system was strong enough to fight. No? So hindi death sentence ang COVID. If your immune system is strong, you will be okay. Okay. So even if you are elderly, a senior citizen, but your immune system is strong, do not fear. Diba? Do not fear. When I first got tested for COVID, I was hoping I would be positive. No? Parang no? Kasi asymptomatic naman ako. So I was hoping I would be so parang I got the bakuna already, but my first test said I was positive. My second test said I was positive. No, but they were Chinese tests, so it wasn't very accurate. No, when I used the good one from the US, it became good. No, negative pala ako. No? So anyway, that's it. Okay. Let me see. What else? I hope I didn't digress too much there. Any more questions? Okay. About the vaccines pa. Let me go back to the vaccine. Okay. So, itong bagong vaccine, so normally to make that old vaccine, you get a pathogen, you weaken it, then you inject it into the body. Then the body produces antibodies, no, para may memory. Do you know that the new vaccine is different? No? The old style takes about 8 to 12 years. No? There was one that took even 40 years to make it. The new style, of making vaccines is a little more dangerous. No? You deal with the molecules, you deal with the RNA or DNA. No? This started with plants. Sino ditong agriculturist na ano? Those who understand plants. What they do, historically, no? Kung may plant, no? Let's say a rice plant. The rice plant is susceptible to black rot. No? That's a kind of disease, black rot. Okay? What the scientists did was, yung gamot sa black rot na yan, no? Hindi rat, daga, rot, R-O-T, bulok, no? Black bulok. No? Ang gamot sa disease na yan, no? They were able to take the genes and put it inside the plant. Okay? So now the DNA of the plant may natural na gamot, no? Anti-black rot. So when you plant this kind of rice, kahit na may black rot, everywhere, yung rice variety na yan, hindi magkaka-infection. Kasi it has an innate or a natural, not natural, no? It has a unnatural DNA that can fight the black rot, no? Yeah. This is called genetic modification. Okay? Ito yung sinasabi nilang GMO. Okay? Now, in plants, it can work. In fact, in plants, it's kind of good, no? I remember they did this to not for disease but for more rice production, di ba? Kasi ang problem ng rice in the world is baka there'll be one day that the agriculture sector cannot feed the whole world. So they developed the rice that could give 5 times more rice, no, than a regular plant. That became our miracle rice of 1969 ata or something like that, no? Miracle rice. 5 times more ang production, no, with the same amount of land. So that GMO was okay, no? Okay naman yan. Kaya I'm not all anti-GMO, no? Kasi sometimes it's good. That same system they tried to use with animals, no? In the veterinary circles, no? And it wasn't very good in the veterinary circles. In fact, it was banned afterwards, no? Bawal nang mag-GMO sa mga hayop. Diba? So, bawal. They're not using it. Now, that's the same thing they're using for the new vaccine. The mRNA. They're using the messenger RNA of the virus, no? Duplicating it, getting the, and putting it into a vaccine. That vaccine is going to be injected into us, no? And it is going to be incorporated into our DNA. Okay? So that our DNA now, kapag dumating ang COVID, agad-agad, no, sorry, dead ka, COVID, no? Kasi yung DNA ko may anti-COVID na proteins, no, or molecules. But the funny thing is that makes you GMO also. You get that injection, no, to change your DNA. Ikaw mismo, you are a GMO. You are a genetically modified organism, no, for changing that. Now, sige, pumila kayo. Sinong gustong maging una dun sa experiment na yan? Di ba? Sino? Not me. No? Not me. No? Because imagine, 1 year lang. Yung iba, 8, 12, 40 years. Ito, shortcut. Ang nasa isip lang nila is gumawa ng pera. Di ba? Tapos, you will get that vaccine. Wag na. Which is why I stressed in my lecture kanina, do not be afraid. Diba? Do not be afraid. Yeah, nasa immune system na yan. This is our major opportunity to change our diet, to exercise a little more, to be more knowledgeable and more judicious of what food we're going to eat. Diba? Not canned good, not sugar, not processed foods. Try to get the more organic, the more natural foods. This is our opportunity. Maybe God is trying to redirect all of us. No? So let's not make that wrong decision now. No, let's do it the right, the healthy way. No? Malay mo totoo palang zombie after you get magiging zombie kang diba? I don't know, no. But don't play around with that kind of technology na driven by capitalism. No, not right. That's the reason why I like acupuncture. No? The acupuncturists before in China, they weren't even paid. They just had the honor of being the acupuncturist of the village, diba? I am the one that will take care of the people of the village. Walang no? Ngayon is, sige, ito yung ito, bayaran mo ako, I will treat you. Hindi tama yan No? You treat the person whether he pays you or not. If he pays you, maraming salamat. If he doesn't, maraming salamat din for the opportunity to take care of you. Because God is the one using you, diba? God is working through you. Did you pay him for anything? Wala ka naman utang Or he doesn't have any utang to you. You have utang to him. So you do your healing regardless, regardless of anything. So again, are vaccines good? Are they waiting for the vaccines? Make them wait for the vaccines. Okay, they're playing a dangerous game. No, they're playing a game of greed. Okay, don't play that game. Don't fall into the trap. And then they're going to make it mandatory to get vaccines. Do not talaga. Ako magsusuntukan ako dun if they try to inject me. No? I'll get that thing and inject their eye with it. Do not let your children take it. Do not let your parents take it. You yourself do not take it. Maybe you can wait 10 years, 20 years. Okay? If the ones who took it are still alive, maybe you can consider, di ba? Pero malamang they'll be glowing in the dark na, di ba? May side effect na yan. Okay? That's my answer in why are they waiting for vaccines? Bahala sila sa buhay nila, no? But that's not good. How to apply evidence-based medicine in TCM? Okay. Doctora de la Paz. Okay. My seatmate. This is my personal thing about evidence medicine, okay? Evidence-based medicine. I think it's a lot of crap, no? In another term it's bullshit, diba? Evidence-based. It sounds good. It sounds very good. But again, it's a crazy game that the West is playing, no? Example, and some of my students know this. Nung nag-College of Medicine ako, I joined a fraternity. Okay? Bugbog sarado, di ba? And after the initiations, ang medicine na binigay sa amin ng mga doktor, kasi it's a medical fraternity, ang nambugbog sa amin, mga doktor din, they gave us a medicine called papace. Okay? Papace comes from papaya. Active ingredient, papain. No? Papace is an anti-inflammatory. Okay? Yan ang gamot namin dati sa PGH. When I was second year med school, na-invento ang yung NSAIDs, non-steroidal anti-inflammatory drugs. Ibuprofen, diclofenac, mefenamic acid, ba? Lahat ng ganyan. Alam mo ba, after that was invented, pinagbawalan nila ang papaya. Yung gamot na iniinom namin na papace. Bawal. Walang evidence daw. No? Baka magkasakit kayo sa papaya. Diba? Baka may side effect na And I was telling them, that's really so stupid, diba? Na papaya ang may side effect, no? And they should use ibuprofen and mefenamic. Parang anong sinasabi nyo? Anyway, pinagbawalan. In fact, they took it out of the market. Okay? Tell me, anong side effect ng papaya na medicine, di ba? And I was telling them, even if the whole papaya falls on your head, you won't even get bukol, di ba? And the only way to die is if you put a whole papaya into your mouth, you might choke. But papaya to give you a side effect, an adverse side effect, is ridiculous. It is ridiculous. Do you know now, today, the main cause of death in the US for 80 years old and above is the intake of NSAIDs, ibuprofen. Ibuprofen is the main cause of death, no, for 80 years old and above in the US. So, alin ang dangerous? Yung ibuprofen o yung papaya? And yet, papaya ang bawal. No? Kasi walang evidence daw. That's ridiculous. Papaya has been around for thousands of years. Diba? Ibuprofen since 1986 or 87 lang ata. No? Something like that. So it's a game that they play. No? It's obvious. It's a game that they play. Evidence-based, evidence-based. No. Acupuncture, no evidence daw. Diba? Okay, so what does 5,500 years have kung walang evidence yan? Diba? It's insane. So when people talk to me about evidence-based, I don't play that game. Okay? I don't play that game. If they want to play that game, they do. But Dr. Me, I'm okay. I don't care about what they say, no, about this evidence. Turmeric, di ba? They all say, ay, nako, turmeric, walang evidence on turmeric. I tell you, and I told this already to my class before. No, I was giving a talk with some doctors many years ago, and I mentioned turmeric, and I was talking about turmeric, and there was somebody in the audience, in one of the tables in front of me, surround table, who shouted while I was talking, who shouted na walang evidence, yung hindi evidence-based ang turmeric, no? Ganun, no? Doctor shouted at me, no, na walang evidence yan. So that only showed how ignorant he was, no? You know me, I'm not I'm not the palagalit type, no. Pero dahil binastos niya ako, I became mataray. I actually asked him, sir, which of the 64,000 studies on turmeric did you not read? Di ba? Nung sinabi ko yan, tawanan yung yung audience. Parang, parang tumahimik yung tao. No? But see, there is so much evidence not written in the US. No? This is Chinese, no? So it's not written in the US. This is mostly Asian, but there has been so much studies on it. And look now, no, everybody wants talaga their hands on some turmeric, even if there's no evidence base, supposedly. Okay, so don't play that game. Is there any other, I answered that. Any more questions? Vaccine. Agree. Look at them vaccine. Oh, tingnan mo yung deng vaccine. Tama yan. Pera lang ang Sana kayo. Okay, no. Yep. Okay. Again, I want to say thank you. If you have any questions, you can always PM, whatever that means actually, but I see that everywhere. You can PM me, text me or whatever. And we can discuss further siguro kung kailangan niyo. Okay? Jackson, are you around na?
Yeah. Okay, Doc. There's a follow-up opinion.
Okay.
Sana kayo na lang daw ang pumalit kay Duque.
Sorry, pero si Duque is not doing very. But anyway, let the Lord do what He has planned for the Philippines. Okay, trust in Him always. Trust in Him. Sometimes you will not be able to understand Him, but who are we to be able to understand God? Diba? Who are we? Just trust in Him. Okay. Do not worry. No fear. Practice your. He gave you a gift of healing. Use it. He gave it to you to use it. Diba? He didn't give it to everybody. He gave it to you. So you use it in His name. Okay?
Okay. Thank you very much, Doc Mikey. Thank you for sharing this wonderful lesson, sharing your insights and your knowledge.
Okay. Yeah.
Maybe we can call on Dr. Tan Cho Chong if he has anything more to add before we close.
Doc. Doc, nakamute.
Doc, you're still muted. Yan. Okay. You're still muted, Doc. Still muted, Doc.
Hello?
Yan.
Hello?
Okay.
Can you? Yeah. Again, we like to say thank you, to Doc Mike, for this very lively and very holy lecture. And also to Jackson, for organizing this, okay, and to Doc Al Lagaya and to everybody for joining us. Okay, so I think next Monday again we'll have Rochi will talk about acupuncture and back pain.
Ah, good.
Okay,
Good,
Rochi.
yeah.
She's the secretary of PAAI. Okay, si Rochi. Is Rochi with us today?
No, Doc.
She's not with us,
around.
Okay.
Yeah.
So we'll have another topic outside of COVID. Okay.
Yeah.